So, hello everyone, welcome to the Annam Chaudhary Materia Medica, and today I'm going to talk about the medicine Abrotanum. Abrotanum is a very well known medicine for the children, especially for the marasmus of the lower extremities, and also very important medicine for the people who have the ravenous hunger. In spite of having the food, they are very weak, and the assimilation problem यहाँ पे रहती है, and also the people who have the problem in childhood, especially they are thin legs and the pot bellied, and their constipation alternate with the diarrhea. Okay, and even after eating proper food, they are very weak, wrinkled, and malnourished kind of a children you get to see in this medicine. Okay, आपका even in that in pains you see that the alternation of the symptoms are very common symptom of the abrotinum. Diarrhea alternate with the knee joint pains alternate with the piles. So these are the symptoms. But what Nam Chaudhary sir says is there are basically he differentiated this medicine, the marasmus, with other medicines as well. Like in the first, he clearly given a 5 points, that is the marasmus of the infants, wrinkled tummy and the crossed depressed baby, progressive atrophy in spite of ravenous hunger, and the marked prostration and cannot even hold up the head, and the emaciation more marked in the lower extremities, alternate diarrhea and the constipation. So very, as I told you, very important medicine for the children. This medicine is prepared from the fresh leaves and stem of the lady love. So marasmus of the infants, if any patient comes to you with a very weak and cannot even hold the head and looking like a wrinkled and malnourished children whose legs are very tiny and the stomach is pot belt, and if you see the constipation, sometimes constipation, they suffer with the constipation and which is alternate with the diarrhea. So you need to, what is the first medicine which you need to come in your mind is the abrotinum. For the, and also this is one of the good medicine for the people who have the uh, protruding hemorrhoidal tumors with a burning pain when touched. And one very important point you need to remember, and the first medicine you need to give in this cases of the oozing of the blood and moisture from the navel. So not only in the children cases, in adult cases also you get to see oozing of the moisture from the navel and suffer with the constipation alternate with the diarrhea. Abrotanum is the medicine which, I mean, immediately it will give you the relief, my dear friends. You can use in adults 200 potency, children 30 potency. I personally used in multiple cases, so I got a beautiful results. And thing is, constipation alternate with the diarrhea and the moisture oozing from the navel, and that is something, blood is oozing from the navel, that is also you may get to see in the infants. Okay, marasmus especially in the lower extremities, very weak, wrinkled, मतलब ऐसा दिखता है कि baby is a mal nourished, उसका nourishment ही नहीं रहती है, and even after having the ravenous hunger, assimilation is not proper in this kind of patients. And very important medicine for the joint pains with a checked diarrhea. So what and Annam Chaudhary sir compares this medicine with the ethusa, antim, crude, barita carb, calcaria carb, cena, iodum, natrum, or petroleum, phosphorus, sarsaparilla, silicea, and the sulfur. So one after other I will explain you how he beautifully differentiated this medicine with other medicine. This is a practical thing, my dear friends, and if you see this, if you remember these things, you can easily differentiate the marasmus cases very easily. So ethusa is one of the medicines where you see the in ethusa as well, the child infant cannot hold the neck, means उनको ताकत नहीं रहती है, just like a abrotinum. But how to differentiate this medicine with the abrotinum? In ethusa you will see a vomitings, intolerance of the milk, and they vomit a lot. There is a vomiting is present, then ethusa is one of the very important medicine for the marasmus and unable to hold the neck and the wrinkled face and the mal this may be child will look very mal nourished child. So but the thing is the vomiting is the prominent feature of the ethusa. So after vomiting, the patient, I mean the child, exhausts and sleeps. So that is the ethusa. But whereas in the abrotanum, ravenous hunger and the weak and the weak extremities you get to see. And the next medicine which comes in the list is the antim crude. Antim crude also you get to see of marasmus. But the thing is, along with the the weakness and all, so the most important thing is the gastrointestinal system is involved. Mostly the diarrhea you may get to see, along with that cross child, white coated tongue, stubborn child, cranky child you get to see in the antim crude. It is very easy to identify the antim crude. Antim crude ka patients may you get to see a white coated tongue. In antim crude patients, mostly you will see the constipation. So of course in antim crude as well you get to see the constipation alternate with the diarrhea, but more early diarrhea you get to, the watery diarrhea you get to see in the antim crude with the marasmus and the weakness. And the pot belly is maybe absent. Pot belly and the thin extremities is something will help you to differentiate this medicine. And the white coated tongue also one of the very important medicine. And antim crude children are more cranky. Okay, so and one more very important thing in antim crude is they are a chilly patients, lack of animal heat, which is clearly given in this Annam Chaudhary Materia Medica. And the next medicine which comes in the list in the marasmus is the barita carb. Barita carb is very easy. Usually you see the tonsils and all, and enlarged glands also say. And also the mentally, physically the babies are very weak, means mentally they are not matured enough, and physically also they are short. And by looking them itself you will understand these are all the barita carb. And a barita carb morely you will see the glands involvement. General tendency of swelling of the cervical and the other glands is also to be noticed in this remedy. And again in this medicine also marasmus weakness you get to see in the barita carb as well. But the thing is mentally, physically they are very weak. Mentally means the retarded children, with involved glandular involvements. Barita carb is, it goes more towards the barita carb. And the calcarea carb also very weak people, but they look very flabby. Uska adipose tissues जो भी है, fat tissues are very good. And but their muscles and bones are very, they look like a good, healthy baby. But whereas in abrotanum they look tiny, very wrinkled face, hanging in the folds. This is also given in the first paragraph itself. Hanging, उनका जो भी है muscles ऐसा hang करता है, especially in the joints area में hang करता है. But whereas in calcarea का अच्छा से उसको गाल वोल सब कुछ फुला फुला रहता है. बट द थिंग इज देयर बोन्स आर वेरी बिग, देयर मसल्स आर बिग, दे डोंट हैव द स्ट्रेंथ, एंड द head is filled with the perspiration. This is the calcarea carb. Again it is very easy to differentiate. And the weakness you get to see, they look like that but very weak. So they are looking very weak by itself. Seeing itself you will understand they are very weak in abrotanum. But calcarea carb, again it is very easy to differentiate with the abrotanum. Weak but they look, उनका फैट एडिपोज टिश्यूज, उनका जो भी गाल वाल, उनका बदन वदन अच्छा फैट उसको अच्छा से रहता है. बट मसल्स आर वेरी वीक, बोन्स आर वेरी वीक इन calcarea carb. Cena patients also very marasmus, cranky. They are also, their nutrition भी ठीक से नहीं है जैसा लगता है. But the very important thing is they have the worms. How to identify? They have the itching in the anus, itching in the nose, stomach pain, and the staring at one object, and these are all the indications that the baby is having the worms in the stomach. That is something a very important thing. Very cranky again, and saliva you get to see in the morning. They wake up, you see the saliva is running like this. Okay, bedwetting also you get to see. So, and they study, and all of a sudden they stare at one point, and that is the critical indication of the, you know, having a worms. And also this white color discoloration you get to see in this area. And the anal itching is one of the very common symptom of the itching. This is something, along with that very weak, malnourished, and the, marasmus you get to see in the cena, but again very easy to differentiate with the abrotinum. And the next medicine is the iodum. Iodum also, even after having the ravenous hunger, they have weak, I mean very very weak patients, emaciation you get to see in the iodine as well, in spite of having a ravenous hunger, just like a abrotinum. But more mesenteric glands involvement means stomach pain, अगर अल्ट्रासाउंड करने से पता चल जाएगा मेसेंट्रिक ग्लैंड्स का इन्वॉल्वमेंट ज्यादा होता है. मेसेंट्रिक ग्लैंड्स मीन्स द जो भी हमारा इंटेस्टाइन्स में, जो भी हमारा स्टमक में जो भी लिम्फ नोड्स है, उसका इन्वॉल्वमेंट ज्यादा रहती है व्हेन इट कम्स टू द आयोडम. इफ यू सी दैट, then the first medicine, mesenteric, induration of the mesenteric glands. So first medicine you need to select in the children is the iodine, my dear friends. Again you see the very weak children, marasmus, ravenous hunger. In spite of that, the baby is not growing properly. Okay, indicate when the hunger is excessive and the child wants to eat constantly. In addition to, we have the swelling and induration of the mesenteric glands. This is the iodine. mesenteric glands का involvement होता है, तो iodine आप कभी भी मत बोलिएगा. And the next medicine which comes is the natrum, which natrum is also one of the very important for the marasmus. Again having the ravenous hunger, but body को, बदन को वो नहीं assimilate ठीक से नहीं होता है. बट द थिंग इज मेरास्मस यू सी इन द नेक एरिया, उनका नेक बहुत थिन रहता है. बट व्हेन इट कम्स टू द नाट्रोमोर, माय डियर फ्रेंड्स, so okay, more emaciation and atrophy is more marked in the throat and the neck of the children. And one very important thing is the mapped tongue you get to see in the the natromore. Herpes and marked especially in the in the neck and the breed, and also the sadness and the profuse sweating, palpitation and constipation are the sure indications of the natromore. Constipation I witnessed in so many patients in the natromore, and so many times I confirm natromore with a question asking, are you constipated or not? Long term constipation you get to see in the natromore. Most of the cases, especially in the children cases में constipation आपको देखने को मिलता है. And also what is that? Palpitation. And not in every case, 50% of the cases में आपको ये मिल सकती है, but constipation most of the cases you get to see, especially in the children cases, and they are like a यहाँ से बहुत ज्यादा वीक. देख के ही आप पता कर सकते हो ये नाट्रोमोर का पेशेंट है. So yeah, and next medicine comes is the petroleum. Petroleum is again the skin symptoms, cracks will be there, and along with that morning diarrhea will be there in the petroleum. Evening, night time no diarrhea, morning diarrhea, skin involvement, dry skin hota hai, and dry cracked skin may be there in the petroleum. Marasmus, when the patient is subjected to a peculiar type of the diarrhea, harassing all the day, all along the day, but mostly absent in the night time. Other prominent symptoms are the marked odor of the garlic in the breath and the feces of the patient. Morning diarrhea with a garlic odor in the motion, garlic odor. So this is so many times I prescribed the petroleum based on this garlic odor and the morning diarrhea. आपको दूसरों मेडिसिन इस्तेमाल करने की जरूरत ही नहीं पड़ेगी. बहुत ही बेहतरीन मेडिसिन है, वेरी इंपॉर्टेंट मेडिसिन, garlic odor and the morning diarrhea. Very important medicine. What is and next he compared with the phosphorus में क्या differentiation है? Phosphorus is like a diarrhea. Again you get to see in the phosphorus, but a watery diarrhea. These are the tiny indications which will help you in your practice, and it will skyrocket your practice. Watery gushing, water tap खोलने के जैसे पानी जैसे जा रहा है, weak है, emaciated है. Phosphorus is the medicine. Phosphorus children are growing very tall, but slender, the pot belliedness, then the pale waxy diaxis, and eyelashes are very soft, hair eyelashes will be there, and frequent tendency for the diarrhea where stools pour away like a water from the hydrant. The great tendency for affections of the bones, and the strong craving for the cold drinks and the cold water is very sensitive people, very clever people. बट द थिंग इज डायरिया वाटर जैसे कि आप यूरिन करते हो ना, वैसे ही स्टूल जाता है. Phosphorus need to be remembered in that condition. Again, emaciation, bone pains need to be remembered. Sympathetic people, again, acute condition में इतना ज्यादा ये सब नहीं मिलता है, लेकिन watery पानी के जैसे स्टूल होना is one of the indications to select the phosphorus, my dear friends. And also desire for the cold drinks and the cold water is also the confirmatory symptom. Marasmus will be there, weakness will be there in those children. Sarsaparilla is in the advanced condition, वहाँ पे बहुत ज़्यादा बीमार हो जाता है ना, in that condition में Sarsaparilla. And morely, the urinary infection you get to see, sand like, the urine में sand जैसे कुछ हो सकता है, and the pain may be present, just like a Sarsaparilla we use for the, renal stones में इस्तेमाल करते हैं. Similarly, you get to see the urinary infection. And one more skin symptom which I want to tell you. The skin symptom is that the eruption on the tongue and the roof of the throat is something a very important symptom. If you see this symptom, Sarsaparilla need to be given. Immediately you will see the results. Like यहाँ पे comparison इतना अच्छा से किया है ना, main points आपको बताया गया है. Even if it is Abrotanum के बारे में नहीं है, Sarsaparilla के बारे में कितना important information यहाँ पे दिया है कि if a patient comes to you with a eruption on the टंग पे इरुप्शन है और रूफ पे उसको इरुप्शन है, Sarsaparilla need to come in your mind. What the next question which you need to check, cross check to confirm the medicine? Urinary infection है या नहीं है, यूरिन पे कोई सैंड जैसा कुछ आ रहा है, नहीं तो स्टमक पेन हो रहा है क्या पास करने से पहले, रिनल स्टोन्स है क्या. If any of these conditions satisfied, if you give the Sarsaparilla in 30 or 200 potency, immediately you see the improvement in the skin eruptions as well. Of course, the marasmus is also one of the very important symptom of the Sarsaparilla. Extreme face look like a shriveled, and the skin and the folds में जैसे कि Abrotanum का जैसा है, wrinkled face, very weak face, extremely looking like a old person is also one of the very important symptom of the Sarsaparilla. Again, next medicine which is compared with this Abrotanum is the silicea. It is indicated in the nervous and the irritable children who, though wasting everywhere present exceedingly in the large head, and the malnutrition is marked in everywhere in the silicea. And one very important symptom to select the silicea in the children cases is the aversion to the mother milk. Of course, the perspiration is also one of the important symptom, but the aversion to the mother milk, especially if you want to select this medicine in the infants, weakness आपको confusion हो रहा है, तो अगर mother milk से किसी को भी aversion है तो silicea आप दे दीजिएगा, 30 potency, mother को दीजिएगा, ask the mother to take and feed the baby. Usually if the infants आते हैं तो मदर के ऊपर डिपेंड करते हैं, तो फूड के लिए, तो आई ऑलवेज आस्क द मदर टू टेक द medicine and feed the baby after that. So next medicine is the silicea, the sulfur child is a happy child, they smile while sleeping, eruptions, skin symptoms will be there, but the one very important symptom you need to remember the sulfur is the dirty child look dirty. That is very important thing. Eczema, itch, eruption, enlargement of the glands, and obstinate constipation are present in and the persistent diarrhea, and the never to be forgotten nauseous smell मतलब हम लोग को उल्टी आएगा. Dirty child, dirt and the filth speak of the ugliness, that is only the encounters in the sulfur. स्मेल आता है बॉडी से, अगली रहता है, बेबी को देखने से ही अगली रहता है, सो दैट इज अ सल्फर माय डियर फ्रेंड्स. ओके, सो या 11 o'clock का टाइम में भूख लगना इज ऑल्सो वन ऑफ द सिम्टम्स. So this is how beautifully N.M. Chaudhary sir compares Abrotanum marasmus with other medicine. I hope you learned. I hope you made the notes. अगर नहीं बनाया तो हम लोग दे देंगे, तो आप एक बार notes go through कर लीजिएगा. And whatever the indication I explained in this medicine in this lecture is very very important. You can use it in your practice and आपको बहुत अच्छा results मिलेंगे. ठीक है, thank you so much.